Okay.
Hi, good morning, good afternoon, and good evening from all the world. And here we have good afternoon. It's 2 p.m. In our time. So I am Professor Bassem Al-Farfoush. I am MSN student, and also I am staff nurse, oncology staff nurse in King Fahd Specialist Hospital in Dammam. So we'll talk today. This is our ninth higher education in focus meeting. Discover, visualize, and reimaging. Our topic today is medical technology and game-based learning in health sciences education. So today we will learn new things and we will enjoy our topic. So I will give you a brief description about our topic today. As the world changes rapidly, we are committed to focus on what matters most, the value of education, providing learning as in higher education focus, discover, visualize, and reimagine. A global webinar series that explores the changes, opportunities, and lessons that educational instruction around the world needs. The series will also involve cutting edge thinking in today higher education. Learn from higher education expertise through through leaders and researchers and innovations as they share their expertise about these contemporary topics that will benefit students, educators, and leaders across all disciplines. So I will share you a small video.
Recording in progress.
Thank you so much, Kautar, for that short introduction. So let us first, of course, start this ninth series of higher education and focus, discover, visualize, and imagine. But of course, as always, before we start or formally start the event, let me first share some of my takeaways from our event with Dr. Matson because it is probably one of the most insightful and something that really made a mark on in terms of how we look at innovation and on how we're going to innovate ourselves, not only in our careers but also in our lives. But if there are some important takeaways from that event, for me it's something personalized, it's something that I can relate with, and one of them is creating new memories, or that you can always start over or start anew. If you will try to remember the story of Dr. Matson, so he was hit by by a thunder, and then he had this experience that he never thought that he will not be able to make it, even reaching to a point that he wanted to commit suicide. And then suddenly, after all those challenges, adversities, it came to a point and became an eye-opener for him to embark on this journey of innovation. So basically what happened to him is something transformational after that experience of being hit by that thunder, according to his experience. It became also an opportunity for him to make an impact in in his own ways as well. That also I'd like to mention that some of the things that I learned from that some of the things that I learned from that event is the importance of reinventing yourself, also the mentality, and probably the most advice that when you have something like you have an idea that you would like to implement, it's like you need to take note of that. I mean, if you are in a normal day or in a normal activity within the day, and if
Doc Benjo, your microphone has been muted. Sorry to interrupt.
yeah, I'm really sorry because I got a little bit distracted. So to the team, please help me just to kindly notify the participants.
I'm helping unmute. Yeah,
It's
I'm
all
helping mute them.
Sorry, doctor. Now we are helping you. Don't worry.
Yep. All right. So basically, what I have learned from that is never give up. I mean, sometimes we thought that we are on the edge, that we will not be able to make it, and that we failed, that we wanted to, like in his case, ended his life and turned out to be something, again, transformational. And for him to be able to think creatively, embark in that journey of creativity, of innovation, and making an impact to his students, to his university in Pennsylvania State University, and also sharing his personal life lessons. So now, to start our event for this afternoon here in Saudi Arabia, let me introduce to you one of our faculty members at St. Paul University, and she is actually the program director for the medical technology program. Let us first call Miss Nesbibi Pascual to give us her words of wisdom before we formally introduce our speaker for this event.
Thank you so much, Dr. Benjo. To our distinguished guest speaker, Dr. Eric Gantwerker, our university president, Mr. Merceditas Ang, fellow allied health professionals, dear participants, ladies and gentlemen, a pleasant day. I am pleased to share some inspirational words about the incredible fusion of medical technology and game-based learning in health science education. Ladies and gentlemen, it's been 3 years since the start of the COVID-19 pandemic. The past years were full of uncertainties, but one thing remains, and that is we need to continue enhancing our knowledge and skills as we embrace the education system that shifted from traditional to online learning, which is one of the biggest challenges to both the students and the instructors. We have recognized that this challenge has created a pivotal point of our learning experience. Thus, the combination of medical technology and game-based learning holds potential to revolutionize the way we learn, we practice, and we excel in the field of healthcare. Medical technology has witnessed remarkable advancement in recent years, enabling healthcare professionals to diagnose diseases more accurately, provide better patient care, and develop innovative treatment methods. In the clinical laboratory, accuracy and precision of laboratory results are crucial in guiding clinical decisions. And the continuous advancement of technology has transformed this field in remarkable ways. However, their true impact can be realized when seamlessly integrated with game-based learning. Games have always held a special place in our lives, captivating our attention and engaging our minds. They provide a dynamic and immersive learning environment where concepts can be taught, skills can be honed, and critical thinking can be nurtured. By incorporating game-based learning into health science education, we can create a stimulating platform that enhances knowledge retention, promotes problem-solving abilities, and fosters collaboration among students and professionals. Now, imagine a world where aspiring healthcare professionals are stepping into a virtual world where they can interact with lifelike patient simulations, making crucial decisions that have real-time consequences. They can navigate through different levels of difficulty, each presenting unique challenges and scenarios that mirror the complexities they will encounter in their future careers. Through this interactive experience, students can refine their diagnostic skills, practice clinical procedures, and develop confidence necessary to handle challenging scenarios in the real world. Technologies therefore bridge gap between theory and practice, offering students a safe and controlled environment to apply theoretical knowledge and develop muscle memory required to excel in their field. By gamifying the learning process, we can create immersive and interactive environments that simulate real-world scenarios. Through virtual environments, we empower students to embrace a proactive approach to learning, allow them to experiment, learn from their mistakes, and understand the impact of their decisions without jeopardizing patient safety. This iterative process encourages a growth mindset and helps students build confidence in their abilities. Moreover, the integration of game-based learning opens opportunities for collaboration and teamwork. Students can work together in virtual teams, solving complex problems, analyzing data, and discussing findings. This collaborative approach mirrors the reality of working in a healthcare setting where effective teamwork is essential for success. They will not only possess the theoretical knowledge and technical skills, but also the problem-solving abilities, adaptability, and teamwork mindset that are vital in the healthcare profession. As we look to the future, let us embrace the tremendous opportunities that lie at the intersection of medical technology and game-based learning. Let us unlock a world where virtual classrooms become a playground for learning, exploration, and mastery. Let us champion innovation, collaboration, and creativity in health science education. By harnessing the power of these two domains, we can shape and empower a new generation of skilled healthcare professionals who possess the knowledge, skills, and compassion to transform lives, and who will contribute to advancement in healthcare and improve patient outcomes. Let us embark on this inspiring journey, and together, we make a difference globally. Thank you very much. Caritas Christi Urgetnos.
Thank you so much, Ma'am Nesta Didi Pascual, for that very powerful and inspirational talk. But of course, I will be introducing now our speaker for this evening and for afternoon in our case here in Saudi Arabia. So Eric Gantwerker is a pediatric otolaryngologist at Cohen's Children's Hospital at Northwell Health, Hofstra, and an associate professor in the same field at Zucker School of Medicine at Hofstra, Northwell. He holds a Master of Medical Science in Medical Education with a special focus on educational technology, educational research, cognitive science of learning, and curriculum development from Harvard Medical School, and a Master of Science in Physiology and Biophysics from Georgetown University. He has a special interest in faculty development and has been a speaker, a conference panelist, or faculty member at hundreds of national and international workshops, courses, and conferences. He is also an active blogger and a podcaster for several organizations, including the Harvard Macy Institute, Harvard Medical School CME Online, and Black Table Innovations, and several others. He has been featured in the news, in print, and through live interviews, including media outlets such as USA Today, Business Wire, The Washington Post, Nature Medicine, Fox News, WebMD, and Kevin MD. He also works as the medical director of the medical video game company Level X that utilizes game technology and psychology to create relevant interactive experiences for healthcare professionals. He oversees all the medical and educational functions of the company, including strategy, design and development, and efficacy studies. Through his endeavor, he is recognized nationally and internationally as an up-and-coming expert in the implementation of educational technologies and gaming, motivational theory, and cognitive psychology of learning, and putting theory into practice for health professions education. Let us now welcome for this event, let me call in our speaker, Dr. Eric Gantwerker.
Thanks so much for having me. I apologize ahead of time. I'm coming down with a little bit of bronchitis and sinusitis, so I apologize. Yes, ENTs do get sinusitis as well. So thank you all for joining me. I really appreciate it. Let me pull up my presentation here. Oh, it's because you're sharing, Benjo. There we go. Can you see there?
Yes, doctor, we can see it.
Perfect. Well, thank you guys for having me. I do have some disclosures. I do use some copyrighted pictures just for educational purposes. So please don't claim them as your own. I am going to mention some companies, including my own. This is only as an example of some of the different use cases of technologies that are out there. So you guys get a better sense of what we're going to be talking about. As Benjo talked about, really going to talk about discovering new areas and visualizing and reinventing healthcare education. And the address that was just given was fantastic. That's better than my presentation. So you can stop watching now because that was excellent. A great summary of this field and everything that all of us who are in this field are really interested in pushing forward and thinking through. I want to thank Benjo and all the sponsors and you all for joining us, regardless of what time of day it is or what else you're doing. So you all may be asking why you're here. So I ask this constantly. And so really the reason why I'm here was because I went through the same education system that people went through 100 years ago. And there was a lot of frustration around the ideas that you would just sit and somebody would pontificate at you. And the idea was that you would just go home and think about it on your own, do your own experiments and be with patients who are in the hospitals for 2 weeks at a time. That time is gone. And so that whole system of what we call the foie gras system of just shoving stuff into your brain and having you walk out and know what you're supposed to know is just not true. And as the presidential address went from the program director was so excellent about just thinking differently about how we educate. Going away from memorization and going more towards problem solving is really the key that we need to do. This really got me frustrated. And so that's why I ended up getting my master's in medical education. And my specific focus was on educational technology and the cognitive science of learning. And really that turned into this opportunity to work with some game companies that sort of advanced my knowledge in technology. And now I actually split my time 50-50 between the two. The good news is it's 2023 and we've come a long way. Unfortunately, that's not true, actually. I just had a Thai medical student with me for the last couple of weeks. And they're, as probably many other centers, they're in class all day from about 8 a.m. to about 7 p.m. And then they're supposed to go home and study for about 2 hours or 3 hours. And then I don't know when they're going to eat or sleep or see their family. But, the idea that you would just passively sit there for hours and hours and hours, we know is not the most efficient way, yet it's still a lot of ways that people do studying. We do know that memorization does not work very well. So this is the Ebbinghaus forgetfulness curve that a lot of people have seen. So just the idea of memorization and just knowing declarative knowledge, which means just fact-based knowledge, it degrades very, very quickly. And so we need to better focus on some of the more higher level education outcomes that we're looking at. Also realize that the doubling time of medical information is about every 73 days. This means by the time you finish and graduate, a good portion of the information that you learned may be out of date, as well as the textbook that you're reading is out of date. So the idea that we predicate a lot of education on textbooks is actually antiquated model as well. And so famously when Albert Einstein was asked, do you know what the speed of sound is? He said, I don't know. I don't burden my mind with such facts I can find in a textbook. Well, today, those facts that used to live in a textbook now live on your phone that's accessible at all times. The old predication on skills, procedural skills of the see one, do one, teach one also was predicated on the idea of practicing on patients. And simulation has really expanded over the last several decades to really replace some of this paradigm, yet still a fair amount of surgical skills, procedural skills are still practiced on patients for the first time without having any objective assessment of skill prior to going into the patient suite. There's a really huge focus on efficiency. We want to train more people faster, better, at decreased cost. And so the big question that we have is how does technology help us? The first thing that I think about it is we always had this idea that we need to create the perfect sculpture of a student before they leave our purview. And I think that's an antiquated model as well. Just the efficiency and the way that people hand off between systems is just not a sustainable model. And so instead, what I think about is more how Michelangelo described marble sculptures. And the way that he described a sculpture was that he was just releasing the sculpture from the marble. And the idea that it already lives within the marble and he's just releasing it was a great idea. And the idea that he would actually sculpt a good portion of it. And I want to take that to the next level, which is we also need to teach the students to sculpt themselves. And this idea of lifelong learning and how we can create a lifelong learning model is the idea that the sculpture's in there, but we don't have to release the entire sculpture. Instead, what we need to do is we need to give people the tools and the ability to take ownership of their own learning and engage in lifelong learning and sculpt themselves. And technology can help us with that. This is White and Gruppen's model about self-regulated learning. Just the idea that, again, as people go through this process, it requires a lot of input for them to be able to go through this process. There is a large subset of students that you stick them in a closet for 5 years and give them the materials and they're going to learn. Unfortunately, that's not the majority of students. We need to figure out how better to help these students. And we're going to talk a little bit about adaptive learning a little bit later. And the idea of refocusing this on more deep learning and problem solving instead of the foie gras example is where we're going to talk about. And not only are we teaching them the skills of today, we need to teach them to solve problems of tomorrow that we don't even know. So we need to teach them how to think, not what to think. In that vein, technology has been purported as one of the the accelerators of this. And so Moore's law dictates that essentially the number of transistors we can fit on a chip is doubling every 18 months. And this means that the processing power goes up every 18 months. It doubles every 18 months. What does this mean in reality? So if you look at your iPhone that's in your pocket or your Samsung phone or whatever phone you have, it probably is about 155,000 times faster than the computer that put the Apollo 11 on the moon. So just think about that, about the power. You literally have a supercomputer in your pocket. Why do we not use that to help us? Again, when you have all the information in a textbook, now you have it all on your phone. If you, yeah, please mute. So the world of digital technology has exploded. This is exploding by the day. We're going to talk a little bit about generative AI. It is going to be impossible for me to talk about all of this. So we're going to hyper focus on some of the educational outcomes and some of the educational companies, but just know that this is barely scratching the surface. So what are we going to talk about? Why are we talking about it? So one is technology is not only going to change the way that we learn, but it's also going to change the way that we do patient care. And that's a really, really big change in a lot of the things that we've done. And how can we use technology to help us actually take care of patients? Telemedicine and telehealth was a great example of that. Telehealth exploded. It's been around for a long time, but exploded in the pandemic when we were trying to do access to care. We do have to talk a little bit about hype, because hype does definitely play a a component of this because there's so many technologies out there and there's so much interest and hype around this. Unfortunately, a lot of them go through this cycle where we think that they're going to solve all of our problems, and then we realize, they're not as great as we thought. And then eventually we get into the slope of enlightenment where we actually realize, okay, what are the use cases for these? And I want us to look at that, all of these technologies through that lens, which is to see past the hype. And you can see every single technology you've ever thought of goes through this hype cycle. Generative AI is literally like right here. We think it's going to solve every single problem we've ever had. XR was at the peak right now. It's sort of dipping over onto the other side where we're starting to realize maybe it's not as good to solve everything. So we're going to dip our toe into XR. And, the big thing with XR is it's not new, just like a lot of these technologies that you'll realize. Extended reality, which encompasses virtual reality, augmented reality, and mixed reality, dates back to the 1960s. So this is one of the first head-mounted displays by Sutherland and Sproul. And again, the idea here is that you're immersing yourself into a virtual environment. And at that time, they used these ceiling-mounted head devices. For those who are not informed consumers, so virtual reality is sort of this idea of full immersion. I will tell you, these are constantly changing definitions. So these are my current thought process of how I think about them, but there's a lot of confusion that we'll talk about. The idea of virtual reality is you're fully immersed. You only see the virtual environment. The augmented reality is where you see a digital overlay onto the real environment. So you can still see the real environment, but the digital overlay is present and you're only interacting with the digital overlay, not with the real life. The greatest example of this is Pokemon Go. So if you've ever played Pokemon Go, you're interacting with a virtual environment, but you see the real environment behind you. And then mixed reality is where you're interacting with both the virtual environment and as well as the physical environment. So there is no dearth of hype around virtual reality, augmented reality. This idea, it's changing healthcare, has been a conversation for 30 or 40 years. And generative AI is going through this process right now where we think it's literally going to solve all of our problems. And then we're going to think it's going to cause all of our problems. And then we go back to, okay, well, maybe it may solve some of our problems. And this world of XR is ubiquitous. There's a whole bunch of different use cases, from patient care to education to virtual reality exposure therapy, pain control, all those types of things. The use cases are abound, and we're going to talk about some specific ones. But the way that I think about XR is, number one, it's a software, not a hardware. Although the viewing device is a hardware-based device, think of it as the software, because essentially you can view augmented reality through your phone, you can view it through your iPad, you can view it through your laptop. You can view it through a bunch of different viewing devices, including head-mounted displays. But it's really the technology that's running the software on the inside and the type of viewing that you're going to be experiencing as opposed to the hardware. So sort of separate those two a little bit. I think that there is a fair amount of use cases that include this, which is the sort of anatomic viewing, minimal interactivity. And we also use it a little bit for surgical planning. But this is the idea that you would either take a rendered image or a computer-generated image or an actual patient image and put it into 3 dimensions and view it through a viewer. The interactivity with these are relatively limited. You're not actually feeling anything. It's usually slicing or spinning. And again, it's just really good for 3-dimensional relationships that we normally don't get with a 2-dimensional screen. This is the best use case for some of these viewing. But again, the interactivity limits the ability for you to actually have meaningful interactions and understand conceptually what's going on. It's more for a visual representation of a 3-dimensional world and helps you think visual spatially about those different problems. Here's a good example of it. So this is a company called Anima Res that probably has some of the higher end graphics. So this is viewed in augmented reality. So they have a Microsoft HoloLens on. You can see sort of the level of detail of the heart. It looks beautiful, but you can see the level of interactivity is limited to pretty much spinning it, slicing it, cutting it, pulling it apart. And then you have a lot of text that is helping you understand it. Again, we can argue as to whether this is a good use case or not. I think a lot of the reading words in VR seems very silly to me because, again, why are you using a 3-dimensional something that specializes in 3-dimensional to create a paragraph that they have to read or a 2-dimensional video that they're going to watch? Again, we're going to be very critical of some of these technologies, but I think, for this, there's definitely use cases, but here I think this is a little bit of cognitive overload in the sense of all of the text that they have to read, which seems to be a little overwhelming for a lot of people. This was the HoloLens example from the Cleveland Clinic Case Western. So this was actually one of the first examples of integration into medical curriculum. This was the idea that they could actually replace cadaveric dissections with VR and with AR. And I think, again, that promise is still not realized yet, because, again, that inability to touch and that inability to interact meaningfully with the tissues limits some of the learning that can be had from these different technologies. And again, this is limited to slicing and dicing and labeling different anatomic structures, which, if the three-dimensional relationships between the different anatomical structures is important to understand, then VR and AR are a great use case. There's another level of interactivity, which we call haptics. So haptics is the idea that you would actually meaningfully interact with the specific digital model, but you will have some feedback. And so the feedback that usually comes with haptics is force feedback, vibratory feedback, and sometimes touch. The haptics world is really not there yet. So we're going to talk a little bit about some of the use cases. You can see on the bottom right, there's a stylus that the Phantom has a little bit of force feedback and vibration. This is probably the most utilized. And you can see there's a temporal bone simulator down there that they're actually using to train people how to do temporal bone dissections, which traditionally was done with cadaveric bones. But cadaveric bones, number one, are very expensive, and they carry CJD. So we don't know how many people who have interacted with cadaveric skulls are going to have CJD one day. But again, I think the idea that we could replace some of that training with a virtual that is clean and portable is really the promise of what we would like to see with XR. And you can see here, there's other use cases using joysticks as instruments. Again, we're going to talk a little bit about the sort of the cognitive energy that it takes to interact with VR is a little high if you've never done it before. So have a lot of people here done VR. So you can't really raise your hand, but if you give me a thumbs up or something, that'll be helpful, because I want to know sort of what your level of interaction has been with VR or AR, even if you play games with it. You can put it in the chat, or you can just give a thumbs up. I'll take the silence as no one. There's got to be some technophiles here.
There is, doctor, but something related to education. I think just in most of the conferences, I was able to try it. But for example, in our school, in our program, we don't utilize something like that yet.
And what was your experience with the one that you tried out at conferences?
From the last one, because I attended that conference in Riyadh. Actually, doctor, it's quite a new experience, and it's really how can I say it? You are actually seeing actual as if you are in the real how can I say it, workplace, or in the real clinical setting. Because what I have tried, doctor, is something related to nursing. So it's really more on what are you going to do next after doing this procedure, but as if you are in the clinical area, like in
Correct.
the actual site of the area.
Yeah. So
But
I'm going to show you examples of that. Yeah. And did you feel like the learning that you had in that environment, or that your students would have, was a value add to what they're doing right now? Do you think it provided value?
I think, doctor, considering the generation of students nowadays who are technological natives, and the way that, like in the classroom, most of our students are using their, honestly, phones and iPads. The level 3, the last group of students that I taught. So I think it will be something that is really, how can I say it, beneficial for this generation specifically, because they want to do everything using their gadgets.
100%. And I think that's a great example. And we're going to talk about some of the examples here in nursing. I don't know if, can you hear the audio?
We don't, doctor.
Okay, that's fine. So there are these scenario-based VR, and I think that's what you were sort of talking to. So thank you for teeing that up for me. There is no doubt that these experiences are very immersive. And one of the biggest problems, or not really the biggest problems, is we always talk about simulation and suspending disbelief. And the idea that we could suspend disbelief in VR seems a lot more plausible because you don't have a sense of the world around you and you really are immersed in these experiences. Again, I think immersion is a very, very important component of learning because that context-specific learning and the ability to transfer learning to the clinical environment is a much more near transfer if you are immersed in your context-specific, right? And so I think VR can be very helpful in that. There is an element of cognitive overload that happens in VR, though. So you have to take into account that your learners, exactly. So you have to take into account that your learners are having to process a lot of inputs. And you talked to Benjo about digital natives, and that's a huge, interesting divide that we're seeing is that there's a lot of students who want this, and the faculty just aren't in a place where they really understand how to use it. They're really not digital natives in that sense. Obviously, that's a generational gap, and that'll change as time goes on. But I think that you're starting to see a lot more applications of this. But I do think you have to take into account the level of sensory overload that can happen in VR, because something like that, you didn't hear the audio, but the audio can be deafening. It can be overwhelming. There's so much going on. And again, if that is part of the learning process that you're trying to imbibe in the VR experience, like, hey, you're going to be in an emergency room, you're going to be in a trauma bay, you're going to be in an ambulance, you're going to be in a helicopter, then I see that as a interesting context-specific application of how to learn that environment. But if it's a quiet clinic, I don't know if the immersion is definitely necessary. So there's a bunch of different use cases that are being used. And so here is an OB suite. This is actually more mixed reality. So you can see there's an actual physical pregnant woman, and there's a digital overlay. This is a rendering. So this is like, hey, what would the future look like? And I think there are some exactly. In fact, it's all learning styles. Absolutely. This is UbiSim. So UbiSim has a lot of simulation, and they're really going headlong. And maybe this is one of the vendors you had talked about, Benjo, when you looked at it. Again, excuse me. Immersing yourself in a clinical environment is important if that is vital to the educational experience and part of the objective. But be very mindful of your learners, where they're at in their learning journey, and how much this is going to affect their cognitive ability to extract the educational objectives from the experience. This is another example. The Indiana University has done a lot of stuff in VR, so you can see the Samsung VR headset. I will say, especially with phone-based VR, and really when we saw with Google Cardboard, one of the biggest problems with VR is you can't wear it for very long periods of time, and a certain percentage of the population can't wear it because they get extremely nauseous because of the mismatch between the vestibulo-ocular reflex. So you're moving, but the frame rate may be too low for you to actually visualize it. And so that mismatch makes a lot of people nauseous. So there is a limitation for the amount of time people can wear it. There's a limitation for who can wear it. So again, when you're thinking about going headlong into a technology like this, just think about the accessibility and the ability for other people to experience that, as well as the portability, right? So if you're beholden to any kind of hardware, just like simulation, mannequin-based simulation, you're beholden to hardware that needs maintenance and has costs associated with it, as opposed to software solutions. Software-based solutions are more ubiquitous, more accessible. They're around the same price point, but you have more accessibility per person than you would for something that's hardware-based. We looked at this technology ourselves, extended reality, specifically looking at the educational outcomes of using XR. One of the biggest takeaways that we had was that the definitions are all over the place. So what people are defining as XR is a highly variable a highly variable entity. So myself and my student are actually specifically looking at better defining VR and AR for research purposes and really looking at educational outcomes. The idea that the educational outcomes in a lot of the VR based is, do you like this better than sitting in a lecture? That's really low outcomes, right? I mean, we should really be moving past that. And unfortunately, especially when you're looking at some of the technology companies who are publishing on this, a lot of it is, oh, it's better than traditional. The problem with that is yeah, people are going to be loved to be in VR because of the novelty, but what are the educational outcomes? What's their ability to transfer and problem solve using what they learned in VR versus what they learned in the traditional educational system? And that is really we need to go. So I implore all of you as educators, as you teach your students and you try out these technologies, try to get higher level outcomes. Did they learn something? Did they apply to their job? And ultimately, did patient outcomes improve? And until we get to that point in this specialty or in this area, we're not going to be able to say that this is worth the investment, because again, that next level is it worth the investment? Be better than what exists out there. So this is why a lot of the systematic reviews have not shown great outcomes, is because it's expensive. Educational research is difficult often. And especially when you're talking about versus traditional, you always have to do adding the educational intervention as opposed to taking away the traditional, as opposed to, normal randomized controlled trials, because you can't really take away the traditional, because if they don't learn anything in VR, you now deprive them of what their other students had. So there's a lot of ethical concerns with doing educational research with these technologies. There is a bunch of patient-based applications. We're not going to go too much into this. I do think that there's a lot of challenges, and this is a non-exhaustive list. We talked a lot about a lot of these things. I do think cost is one of the biggest problems. The other is the design of these experiences. So, the low fidelity graphics, and sometimes we talked about the frame rates actually affect people's ability to stay in VR. The other is I'm not a huge fan of using joysticks to learn a procedural skill. So if you're, there's an example that I didn't show today, but it shows people how to draw blood, and they're doing it in VR. I think because the idea of using a joystick to wipe a person's arm with alcohol and insert an IV, that skill will not transfer at all. So there is no purpose for that to be done in VR. A task trainer can do that. Having a live person do that much, much better than actually doing that in VR. So again, there's a lot of bad use cases of VR for some of these applications. So think very critically about how that person's going to transfer that to the real world. So we're going to talk about, we're going to move on to artificial intelligence. Any questions about VR? We're going to talk about gaming here in a second.
Actually, Doctor, this is mostly new to, honestly, like most of us. Like even me, yes, for someone like me who is already leading programs in bachelor's and master's in nursing. So this is really, but these are opportunities, really. But this has been discussed in, theoretically, but really in practice, we haven't really, have that kind of experience yet.
Yeah, and I think the idea you're at is where a lot of people are at. And when you're starting to think about critically, like, hey, we want to use these technologies, I want everybody to think about, okay, why are we using these technologies? And if you look at curriculum development as a whole, really what you look at is, okay, what is the learner trying to learn? Long before you try to figure out how you're going to deliver that education. So that's like step 5 or 6. And so the problem we're seeing in educational applications of this is they say, I want to do something in XR. And the question, and especially with my role with the company, a lot of people want to say, we just want to do something in VR. And then we go into this deep dive, say, why? What is it that you are trying to teach in VR that you can't teach any other way? And most of the time, I'll tell you about 90% of the time, no joke, they don't need VR for what they're doing. And in fact, they don't realize that VR is actually going to inhibit the education and cost more and probably be less effective as some of the solutions they already have. But there's just this general interest in using these technologies. And if you walk away with nothing else, is there are wonderful use cases for XR in education, regardless of what health professions you're in. You just need to think critically about how is this specific application of technology going to enhance the learning instead of detract it? And how is it going to help you meet your objectives? VR is not going to replace what we call soup to nuts, which is basically every part of the educational journey. It's going to be a small part of that educational journey where things are just difficult to understand, the three-dimensional anatomic structures, team-based learning is going to be interesting in VR when you have immersive environments where you have multiple users across multiple locations. So the virtual presence and the team-based learning is going to be really interesting in VR. That's a wonderful value add, because getting people in the same room and immersing them into a team-based environment is going to be difficult. If you could do that in VR, that would be a wonderful experience. So again, like thinking critically about how it's going to add to the education and if it's going to be worth the cost, because cost always comes into play.
Doctor, I agree with what you said about the like usability. Like for example, in a particular program in nursing, we have the bridging program. We have the RN, and these nurses are actually already registered nurses who want to acquire the Bachelor of Science in Nursing. So they are already practicing. They have the skills, but it's really more on how they are going to increase their clinical reasoning capacity. So
Yep.
from my reading, from my reading, because we have been exploring this area lately, because we have a new cohort of this new program that we have just implemented. Because they're adult learners, they're already on their 30s and 40s, and they will be having their clinicals, and we're trying to find a way on how are we going to, of course, are we going to be placing them still in the clinical areas when in fact they're already skilled in the clinical areas. So looking at other opportunities on how to leverage the way they think, to do clinical reasoning and other areas or domains of what they need to acquire in that particular program. So that's why it's kind of really interesting for me to.
Yeah, I mean, yeah, and we're going to talk about games here in a second, but that would be a great application of that, because again, games are predicated on giving you the ability to use your knowledge to solve problems. And I think games are a great example of that. And obviously there's a lot of crossover between these different technologies, including XR, AI, and games, which is why we're talking about it today. But games are predicated on problem solving. And so I have some good examples for that we'll talk about in a second. We're going to whip through artificial intelligence because I think again, there's a lot of hype, but there's, from an everyday educator, we're not necessarily leveraging these technologies as much. But the only reason why I bring it up is because this will be a part of the future of how we do patient care, as well as how we educate. And so I think it's an important topic to talk about. So AI obviously is leveraging, intelligence that basically allows problem solving similar to what humans can do. Again, AI is not new by any stretch of the imagination. It stretches back to the 1930s and 1950s. Alan Turing and his Can Machines Think gave way to the Turing test, which is basically, can you tell whether you're interacting with a bot or a human? And anytime you reach out to a customer service center, you're going to be asking this question. We do think, and especially with ChatGPT, which we'll talk about in a second, some of the Turing test has actually been challenged. And so the question is can we still tell the difference between a human and a bot? And there are some, we're still not totally there yet, but we're very, very close. So AI came into being in the 1950s with Alan Turing. It really busted onto the scene when it beat Garry Kasparov in chess, who was a grandmaster. And Deep Blue, if you look at it, was actually doing about 200 million positions per second, something way beyond what Kasparov could do, and just the sheer ability for it to do math, which is what AI does best. There's a bunch of ways that AI does this, and we're not going to go too much into it, but just to understand that it goes through different layers of analyzing data and finding patterns. AI is really good at finding patterns. These are a bunch of different umbrella terms, AI, for a bunch of different technologies, including Siri and all the things that you've experienced in everyday life. Generative AI is not even on this yet. So, generative AI is relatively new, which is, generating images and text. But a lot of these other technologies are already being used in medicine. The idea that we train these models on a bunch of different data sets, and then they build that model and then they adapt it to do different tasks is really sort of what the AI model does. In healthcare, we have tons of data sources. And the idea of how data is going to be managed with the AI and assistance, especially with electronic health records, here in the United States, is trying to make meaningful sense of all these massive amounts of data that we really don't have the ability to understand, visualize, and act on. And that is really AI is going to be our partner in that. And then I want us to predicate the idea that AI is going to be a partner, not going to replace us, which is a lot of fear. There's a bunch of different technologies and a bunch of different applications. We're not going to go into a bunch of them, but there is a genuine fear of people thinking that AI is going to take their jobs. This is not a flippant thing, because there are definitely parts of our jobs that are going to change. One of the biggest areas, the two biggest areas, are dermatology and radiology. So analyzing digital data is what it does, and picking up on patterns. And really, a lot of what dermatologists and even radiologists do are looking at lots and lots of digital data to try to analyze it and make sense of it. And so the idea here is that the AI would help them. And there's actually a lot of applications in nursing as well with home monitoring. So imagine nursing homes and a bunch of different home monitors, all the biosensors that we have. All those different technologies are producing a ton of data that we have no idea what to do with. So the question is, can AI predict? And I'm working with some companies specifically on, can it predict who's going to have sepsis? Can it predict who's going to get sick? Can it predict all these different elements based on the trends of their vital signs? And knowing that all these models that were built on can help define and refine some of those models so that we can actually make them usable. This is HAL, which is basically the idea. There's a 2001 Space Odyssey movie where HAL basically took over the ship and killed everybody. AI is not going to be that. But I do think that there is genuine fear, and especially with generative AI, about the implications not only in healthcare but in education. So there's huge conversations about narrative assessments of students, right? If you have to write an essay, how do we know if AI wrote it? There's a whole bunch of discussion in the world of research publications. So how do we know if somebody wrote the paper or ChatGPT wrote the paper? And I've talked to lots and lots of editors and journal and researchers. They have no idea how to handle and how to screen people for using generative AI for writing their papers, doing their research, writing their grants. All these different things that we do and find mundane and very painful every day is really what AI does really, really well. And I think instead of being terrified of what it's going to do, I think we need to think about the positive use cases and the way that's going to make some of the menial tasks that we do a little bit easier, a little bit better. We're not going to talk too much about this, but there is a lot of problems with AI that are based on a lot of different ways that it learns. And so what happens is it introduces a lot of bias based on the data that it's given. And I'll show you an example of that. But this is an example of how it may help us at the point of care. So if it looks at the EKG and it actually knows statistically, it can say, hey, although this is normal sinus rhythm, are there very nuanced changes from previous EKGs that make us think this patient's going to have an MI or going to have some issues? And these little granular details are really what AI is really good at doing and seeing trends. Medical discovery and training and research, AI-assisted surgery, there's a whole bunch of applications. Objective assessment of skill is something I'm very interested in. So in nursing and in medicine and in surgery, a lot of our assessment of skill is done subjectively by experts reviewing our skills. And the idea that we are graduating people or even putting them into the clinical realm based on experts that don't even have that inter-rater reliability. They're not all judging the same thing. And it is almost impossible to be objective when you're checking off your friends, your managers, all of those different things introduce bias. And so can the AI help us with objective assessment of skills? And the short answer is yes. A variety of different ways. And one way they're doing it in surgery is using visual inputs and actually looking at the instruments that are coming in, how they're handling tissues, and actually analyzing and giving scorecards to surgeons in real time or really after their surgery to say, hey, you did a good job, but you could do better here. As you could understand, telling a practicing surgeon that they could do better is a little bit difficult and something that their colleagues would never do. But the idea that you could use AI as an objective measurement and say, hey, it wasn't me, it was the AI that said this, right? We just want you to get better. It doesn't really matter who gives you the feedback. But again, driving people to want to do better and giving them data in order to do that. It does introduce a lot of bias, just like any subjective assessment does. One of the things that AI has a problem with is, so this was a AI algorithm that taught it how to read pneumothoraces. And one of the things that they realized far into it was it only picked out patients that had chest tubes. And if you think about it, it actually makes sense, right? Because by the time they got a chest x-ray, they probably already had a chest tube in. And so the AI algorithm just thought if presence of a chest tube meant they had a pneumothorax, which is not wrong, but it totally learned it the wrong way. And that was where the humans had to get involved and refine the algorithm to make sure that it knew and had more data from patients that didn't have it. We also have a fear of use of AI. So as I talked about, especially in surgery, having AI actually tell us what to do is unsettling for a lot of people and testing people's egos. The idea that I ask people all the time when I'm giving these talks is your car now has a bunch of features that are AI derived from computer vision and collision detection. Would you back up your car into a busy street without a backup camera? Just because you don't want to use technology because you think you're good, you think you're better than the technology? Would you not do the automatic braking? Would you not use lane departure? All these other technologies that have been enabled by AI, would you not do that? Proximity sensors, all these different things. And the idea is no, you're an idiot. You know, if something happened and you didn't use the technology that you had at your disposal, then you're not using, you're not being your best self. And so here is the partnership between AI and humans and the idea that we could use this for good use cases. We talked about ChatGPT and how it's exploded on the scene. I'm interested to see, have you all had conversations about ChatGPT or large language models in general and how they're going to change the way that we teach and learn? Has anybody used ChatGPT? How about that? It's free.
Yes, doctor, it's free. And I think I tried to, in one of my subscription in, you know, in the plagiarism checker, they also have this option where when you click that, it will totally replace your original write-up.
Yep. Yep.
And summarize.
Yeah, there's a software called Quillbot. Yeah, there's a software called Quillbot that does that. Yeah.
Yeah. And the students are using that. The students are
Yeah.
using that. Actually, most of the master students are using that one.
So I'm interested, have your institutions made a stance or rules about the use of AI for writing up assignments?
Honestly, doctor, in terms of policies, there's none yet. Policies,
Yeah.
procedures, or anything related for that matter. So none.
So I'll tell you what I told all of the journal editors. I said, if you're not already thinking about it, the ship has already sailed. So, you know, I was in a room, a bunch of chief editors, section editors, peer reviewers, and I said, do you have processes in place to evaluate whether ChatGPT or any kind of large language model contributed to the research write-up? And nobody had an answer, 0 people. So that ship has already sailed. So we should think critically. And again, I don't think the answer is to stop everybody from using it. It's the same conversation we had when people got cell phones. We say, okay, are we going to allow them to use cell phones on the wards? No, we're not going to let them use it. They don't need that. They need to know it. You know, that they're going to use it to look up stuff. Oh no, they're going to use it to look up stuff that they don't need to memorize. So again, I think it's the same concept here, which is we are going to need to think creatively about how this can add to our ability to take care of patients and not think about the bad actors and the bad use cases and the nefarious use cases of this. I think we need to put parameters in place. I just reviewed a paper and it was talking about how they were looking at how students use it to write essays, admission essays. And basically what it said was, we don't want students using it to write the essays. But then in the same paper, they were saying, but we do want it to use it to write the dean's letter. And we want faculty to use it to help summarize the personal statements from the students. And so my feedback was, why would you say it's okay for faculty, but not for students? That seems to be a weird dichotomy and a weird line in the sand. If you think it's helpful, it should be helpful for everybody and just put parameters on it. But there's no reason to put one population at the advantage and one population at the disadvantage.
Very interesting, doctor. Very interesting. Because
It's
very interesting. Can you imagine, doctor? I was writing a position paper. This is for something related to the UN Sustainable Development Goals. And then when I tried to put my write-up, it became summarized. But still, I chose to use the one that I have drafted. But it's interesting.
yeah, absolutely. Yeah, but that's a great use case, right? So grant applications are the most onerous things that we write. We spend so much time on writing grants, and most of it is just fluff. And there's really only certain parts of the grant that actually even matter. The rest of it is just they want you to do a bunch of work just to show that you will do a bunch of work to write a grant. Why can't ChatGPT do the first pass at writing the grant? Even if you're going to change 99% of it, it's just so much easier to have something on paper, have it organized, and then go in and edit it than it is to create it de novo from a blank sheet of paper. And so I think that's where ChatGPT is really interesting. I had to do a power calculation. So I was starting a research study, and I don't have easy access to a biostats person, and I'm terrible at statistics. So I gave it the parameters, and I asked ChatGPT, and I said, what information do you need to do a power calculation for this study? And it said, give me these 5 things. So I inputted those 5 things, and sure enough, it gave me a super detailed for all the different metrics and outcomes, what the power calculation was. And then it said, oh, just remember that there's going to be some attrition. So you need to inflate the numbers by about 50%. Because it's a survey, yada, yada, yada. And so that would have taken 3 months for me to get a biostats person to do that. It took 3 seconds for ChatGPT to do it. So again, think about some of the good use cases. This is a big discussion in the US with our insurances, where our insurances have put up barriers to care, and they're trying to regulate how much they have to pay. And so all these things on the left-hand side, the letter of medical necessity, all of the denial appeals, all these things are things that are very onerous in our jobs. And what happened is Doximity, which is a well-known platform for physicians, will actually generate papers for you of letter of medical necessity, of appeals, and it'll automatically send it on the right-hand side to the insurers. It actually will send it in real time to the insurers. And again, this is like a terrible part of our job that nobody likes to do. Is a great use case for AI. But now the problem is now the insurance companies are going to use AI to read and respond to those. So it creates this AI arms race, which is what's happening right now, which is we don't want to create it. They don't want to read it. And so there's just going to be the AIs talking back and forth to decide care. I'm being facetious, but there is a AI arms race that is starting to happen. Yeah, ChatGPT is the most knowledgeable robot, and now it has access to the internet, so everybody be scared. I can't talk about AI without talking about the negative. So all of these AI models, there was a big discussion around data training, and some of the underrepresented minorities were not represented in the data that trained them, and so the algorithms were not actually being equitable to the different people that were it eventually was using to analyze and create information for. And so this is a real big problem, and we are trying to address this. There's a lot of people that are in this space that are trying to address it. Interesting enough, in one of the objective assessments of skills, they actually had humans go back and review and try to refine it based on some of the bias it was introducing. But again, just knowing that bias is there is the most important part, and to mitigate it. Adaptive learning, we're not going to talk a ton about this, but adaptive learning is such an interesting arena for me, because we talked about how technology can enable us to fine tune and personalize learning. So the whole thing about this technology is personalization. We all have our own iPhone covers or our own phone covers. We all have our own wallpaper. We all have our own widgets. We all have our own, everything's personalized for us. We are a personalization generation. Why should our education not be the same? And the idea that technology can help enable personalization. So if you know that, okay, you're not good at this skill, how about when your education is delivered, we don't deliver you the stuff that you already know. That's a waste of your time. That's a waste of faculty's time. But the ability to actually sense, based on your performance objectively, what data you need in order to get you to the same place, is the personalization that can come from adaptive learning or these adaptive learning models. So last thing we're going to talk about is games, and then we're going to stop to answer some questions. We have about 2 minutes left. So games is a huge area of interest for me. Think about any game that you've ever played and how you learned how to play, and the idea that you did not read a instruction manual to learn how to play these games. You just went in and played them. And there's very specific design principles that go into how people play games, and people are using them in a bunch of different skills. So this is Underground. This is actually a laparoscopic simulator that you're using to control the game, but it's an adventure game. And we'll talk a lot about gamification, how good and bad use cases of gamification. But the whole idea of games is we're using the psychology and technology of games to change the way that health professions interact with medically relevant content. When you look under the hood, there's the idea of flow. So this is how people play for hours and hours and hours on end. And the reason why flow is important is because it's maximally efficient learning. What are we trying to do in health professions education? We're trying to be more efficient. Games do this, and it's deliberately designed in the experience to create these flow states. And the way they do it is they balance challenge and skill. So as your skill gets better, the difficulty of the game gets higher. And if you don't keep people in this space, we call it the zone of proximal development that was defined by Vygotsky. Games call it the regime of competence. If you don't keep people in this zone, they'll disengage. Again, the idea of adaptive learning and trying to keep people right at their edge of their abilities. Your learning happens when you're at the edge of your abilities. And if you don't get to your edge of abilities, you're not being challenged, you're not going to learn. There's also the concept of deliberate practice that was really talked about a lot in the simulation world. Again, games do this inherently in the games of the trial and error and trying to figure out, okay, how do I make this jump? How do I solve this level? And that is all the deliberate practice. You're practicing, okay, I got to get this one skill down so I can pass this level or beat this boss. And there's good evidence that games work. Games work for psychomotor skills. They work for attitudinal skills. They work for cognitive skills. We have good evidence that they work. Some of the systematic reviews have not been great, but the reason why is because you can't compare something like a word game to an action adventure game. It really doesn't compare. And so there's a bunch of different game types that always get put together. And again, not great use cases for games. There's stuff in board reviews. So, or in this is for the nursing exam in the United States. So a lot of interesting use cases of games. There's actually teaching clinical. So this is actually an interactive clinical thing that you're talking about. Medscape has a whole host of these things. They're called MedSims. And again, these are video-based branching logic games that are built in for these types of scenarios that you were talking about, Benjo, earlier. Serious games, washing hands, which is probably seemingly one of the most uninteresting serious games I've encountered. MRI serious games, right? So proximity. So here you don't want to kill anybody and you have to understand the zones. This is an interesting use case because again, this is something that people don't want to learn. They don't want to watch a PowerPoint. They don't want to watch a video, but can we have a game where if you get too close, it's going to suck in and somebody's going to get hurt. And so these are really interesting use cases for games. The other area that I've gotten really interested in is in escape rooms. So escape rooms has become popular in the United States and internationally because of nursing, actually. Nursing has led the way for the application of escape rooms to health professions. Medicine is just starting to do this, but nursing has really, really done it. There's a great program from Kansas City that has a whole how to make escape rooms. There's digital escape rooms, there's physical escape rooms, but I'm really getting interested in this. And this is a great use of consolidating knowledge, team-based learning, interactions, communications, really creative way to actually test people, right? So you do skill checkoffs for nursing. This is a great way to do it. You know, if you could do it in an escape room, it's much more interesting and fun than doing it in a sim lab with a bunch of people watching you. So I'm going to talk just lastly about Level X. So our company is really looking to advance the practice of medicine through play. We're using these different technologies and these different psychologies of games. We're trying to reimagine a bunch of different therapeutic areas, including nursing. We actually do have stuff in the nursing area, but really the technology is what we pride ourselves on. So the ability for these game engines to produce really lifelike interactions, really lifelike. You can see our computer generated skin on the top left. That's all computer generated. That is not real in any sense of the imagination. That was all built. The eye on the bottom left, that is no models. That is built by scratch by our team. So we have super high fidelity graphics. We really take very serious how we use these different technologies for value add. Here's a closer look at the skin model. You know, we do procedural training, we do ultrasound training. This is a real-time rendering of ultrasound based on anatomical models. And these are all on your phone. So again, we are mobile-based because we really think software should be accessible and free. All of our stuff is free, so you guys can all download all of our games. And then we also work with, you know, big organizations like NASA and SpaceX. We are actually doing ultrasound training, and this is actually for novices. So astronauts do not have a ton of medical training, and they have to actually monitor themselves for DVTs and for venous thromboses. So we actually create a module to teach them how to actually scan their own jugular veins with an ultrasound when they're in space. And the new SpaceX is actually going to use our game. So we're going to be the first game in space, hopefully. So there's a whole bunch of other technology. So this was one use case for RXR. So this is a spine demo. Again, this is just a demo, but showing you how we can use augmented reality to teach a complex concept, which is spine surgery. So you can see here, there's a bunch of different techniques to do spine surgery, and this is to showcase it. We wanted to showcase the strain that happens on the spine when you're actually doing these different procedures. So you can see just based on color, how much pressure you're putting on. And what ends up happening is when you're registering this, and you can see the AR there, that actually as you put the screws in, you're actually deforming the spine without realizing it. And so it was just to showcase some of the different techniques and how they affect the registration of the spine as you go forward with the procedure. There's a whole bunch of technologies we didn't have time to talk about. Robotics is a huge area of interest of mine as well. The robots are now autonomous, doing surgery without us. And with that, I thank you guys so much, and I'll stick around for some questions.
That is such a very interesting presentation, Doctor. It gives also an opportunity for those who would like to embark on this area and in this field, because for sure most of the, because we have a lot of faculty members here as well. We have some researchers here as well, and I think this is an area that this is an area really that for sure needs more exploration. Although it has been utilized, even utilized in many nursing schools and also in science education. So I guess we will have to I will have to call our dear colleagues here to ask a question and also provide their takeaways from your presentation. And the participants can also type in your questions in the chat box. So I will call first Dr. Jeremy. Thoughts about what has been discussed by Dr. Eric.
Perfect.
Good evening, good evening, everyone. Yeah, the topic is really very interesting, and it really has aroused my interest in technology-based education, technology-based teaching, especially gamification. It's really something. Technology-based gamification. Well, of course, I had been a teacher for more than 20 years now, and I had been doing games in my classes. Although I don't teach in the medical sciences, I don't teach major courses, but I teach other courses. And the games are really very important tools for learning. And the technology gamification is the new way of doing things so that we can arouse the interest of our students, especially at this stage where many of us are still doing online classes. The augmented realities, the topic on augmented reality is really very important. Because that's something that our students must master. This era is actually geared towards the use of technology, the use of AI, and our students are being the next generation are really encouraged to do it, to get engaged or to engage themselves in doing artificial intelligence in their work, because for the undergraduate students who are here now, after graduation, you will be fielded in the real world, and whichever country you will be working in, you will be exposed to technology-based practice of healthcare. So it's very important that our students are here tonight and listening to our speaker Eric, who has given so much ideas, so much inputs on the use of technology and the use of technology in the medical profession, and the use of games in teaching for teachers who are here with us tonight. So these are very important things that we should imbibe as we are still in school at the moment. Now, just a little warning on the use of technology, especially on the use of ChatGPT, because it really is very fast and it has wide range of articles. And I think like what I place in the chat, I think it's the most knowledgeable robot nowadays, But true, but it is true. One of the participants said, "How can we determine the veracity of the references?" Well, I think the the programmer or ChatGPT has I do not know. I cannot say a word for that. Must really be very creative in getting all of these databases, because you can just chat. You can just even chat. Write me a thesis on this topic with the
Yep.
following problem statements. Boom, it goes there. But for
Yeah.
us who know it, our dear students who are here now, be warned that we, your teachers, know how to use it.
I mean,
Thank you.
it's a general intelligence model, but one thing it's terrible about is references and scholarly outputs. There's no doubt, like that is by far, and the reason why is because it doesn't have access to databases. So it actually can't access PubMed or Medline or any of those databases. At least the version 4 can't. There's newer versions that may have access to databases, but because of that, it does not do very good, and it fabricates knowledge. It sounds very convincing. Somebody described it as it basically takes words and puts it into something that looks like a sentence. And I think like that is such a great like way to describe it, because it seems like it makes sense, but basically just put a bunch of words in that seem like, okay, this makes sense. This sort of looks like a sentence, but that's sort of how it synthesizes this general intelligence.
Yes, but doctor, you still need to read it extensively. You still need to read it extensively. Like when I'm doing that position statement, it's like it totally summarized it, but there are a lot of elemental components of the write-up that was for me was omitted. So it's very important still, just like what you mentioned a while ago, that I mean the idea or the thought of the person who's writing it, I mean, needs to be, it's just more of a supplemental support probably from the original.
Well, I'll tell you one really good use case you can use it for today, and realize how many clinical scenarios you use or case studies you use in your classrooms. You generate or fabricate patients for people to study on. Like, okay, let's go through this case together. ChatGPT is awesome at that. And it will unload you for hours and hours and hours. And you could actually introduce falsehoods within the case and use the student's ability to determine what is wrong with this picture. Actually critique the ChatGPT output is the learning, right? Make it purposely wrong. And so that ability, remember, like when we're looking at educational outcomes, like critiquing and analyzing and judging is way up there. So if you can use your students to analyze and critique the ChatGPT output and say, there's something wrong in this patient case, tell me what's wrong, that's a super high level skill.
Also, doctor, I want to call one of our Ma'am Bibi also to give her takeaways from the presentation of Dr. Eric. You may want to ask a question or share something, Miss Bibi, please.
Well, the session for tonight is really interesting, especially in the field of the allied health sciences. We've well, based on based on the session, one of the things that I realized is that if we are the technology is really emerging, and in the case of the chat GPT, I think we being human, we still have the discretion to whatever information that the AI has been generating. We have the capability to digest well if those information are really good, or we can still use those information. And of course, as to the technology, well, we've been looking forward that one day, hopefully, well, with our age, hopefully one day we can use all those, or if not all, some of those technology in the allied health sciences field. And well, still, there is big impact of technology in our field. And if there is one thing that we really need to see is that, or to look forward to, is that this AI is not just to make our work more easily, but of course our priority is the safety of our patient, the outcome of what we've been doing, which is for not for ourselves but for the community.
1,000%. And I think the idea, thank you for that. That was incredible. The idea that technology and specifically AI can help us with patient outcomes, even VR. So there's VR-based therapy, so rehabilitation and game-based therapy. So imagine there's somebody who's in San Francisco right now who's making a bicycle that with VR for rehabilitation and mobility. So again, imagine you have a game. People use gamification in Peloton and all those other companies, but can we use it in doing rehabilitation? Because you can actually have those motion sensors and the accelerometers and everything about motion, degrees of motion, and like thinking about how technology can help us take care of patients. Also realize that from workforce shortages, at least in the US, and I'm sure across the globe, can technology help do therapies, help do things that we just can't do physically. For example, there's cognitive behavioral therapy that's being done with avatars. So there's avatar-based cognitive behavioral therapy for soldiers that are coming back from war zones to help them digest and process everything that they're going through. And they like talking with the avatar better than talking to a human because it's non-judgmental, and we'll actually have a real-time conversation with them. It's part of the whole CBT process, because then they go meet with the actual therapist and say, how did it go with the avatar? And they were more willing to share stuff with the human because it's already out in the ether. They already talked about it with the avatar in a non-judgmental way. And so thinking about how we can extend our abilities to take care of patients across large distances in an era where there's workforce shortages and everybody's being pressured.
Doctor, I agree with what you said. Actually, there are a lot of benefits on the other, I mean, in terms of other perspectives, like in our profession in nursing, there's an extreme shortage. Like, for example, in the US, I think most of my colleagues and friends, their challenges there is mostly clinical placements. So that is why they are embarking on the simulation or the use of these kinds of technologies. And also even in nursing education itself, in terms of research in this field, even the latest books that we have been studying about the nurse educator role or the different strategies, different innovations and technologies, there is really a dearth of, like, for example, in terms of research and in terms of valuable content, particularly specifically in our field. I think is something for the researchers to explore, because even in our books now, you will see their simulation, but really minimal discussion on these areas. So this is something really that is probably an eye opener for most, particularly with the faculty members who's doing research and simulation, because there are a lot of opportunities to explore still, and a lot of yes.
It's a super exciting time to be alive, I have to say. The technologies is so quickly progressing. And everybody talks about VR and stuff like that, but AI is today. Actually, AI is yesterday. So, if you are really interested, I think the implications of all these different technologies, AI is probably the one that I would spend the most time on, because I think it really has a very good chance to completely revolutionize how we practice medicine, how we take care of patients, how we educate our workforce. More than VR, more than AR, I think AI. And what you'll see is if you ever follow anybody who's in this technology space, or what we call medical futurists, if you accept that term, the medical futurists used to talk about AR, they used to talk about XR, they used to talk about biosensors and big data and some of the other stuff. They've all pivoted to talking about AI. And the reason why is because AI is today. It is literally transforming. And anybody who's an expert in this area realizes this is a societal shift that's about to happen.
Excellent. That's a powerful statement from you, Doctor. And really an eye opener for everyone. So we're about to close our event, and it's a good thing that most of the professionals and also some of our students who are here in different levels up to the master's level. We have some students also from here learned a lot from the presentation of Dr. Eric. But of course, we would like to, of course, thank St. Paul University Philippines as always for their support and their unending persistence also and dedication um, to make this event possible. Because I think Dr. Eric have an idea of the struggle. No, no. I mean, but the good thing is that we have St. Paul University Philippines, who specifically the president of the university, Sister Merceditas Ang, for her kindness and always her assistance to even activate most of the members of the university to help us in making this event possible. I also would like to call in my colleagues here for always also being here with us, Dr. Jeremy, and also now we have here Ms. Nes Bibi Pascual and also Sir Alan and another Alan who happens to be absent for tonight's event. And of course, we would like to express our gratitude to the participants and also to the students in Saudi Arabia. But later on, I will be looking at the demographics on where most of our participants came from. And anything else that you would like to say, Dr. Jeremy, as well?
Dr.
I think there are some.
Other universities with real impacts has released the world ranking for universities with for innovative universities, and St. Paul University Philippines has been ranked number 89 all over the world.
Holy
So we
cow.
are happy about it, and considering the topic that we have today, that's on the use of technology and AI, and that's also part of that's also where St. Paul University Philippines ranked number 24th in the whole world for ethical value, and the number one in the Philippines at the moment for ethical value category in WORI. So we are happy to announce that St. Paul University Philippines, while we are turning technology based, we are still anchored on the values. And like what Ms. Nestivi Pascual said, it's always for the good of the patients, it's always for the good of the community. Thank you once again.
And of course, last words, I would like to extend my personal and professional gratitude also to Dr. Eric for welcoming us and gave this platform to all of us who happens to be living in different places and coming from different backgrounds, to have this opportunity for someone like you who is truly an expert in this field, and for us to even have a glimpse of that expertise. We are really amazed to we are thinking right now. Honestly, this is something new. So this is something new, and there are a lot of opportunities to explore and a lot of opportunities to embark and to try, particularly if you are living in a different place or in a different country. A lot of opportunities for us to leverage for our students to meet their learning outcomes. And we are grateful for your kindness and your help to do this event for all of us.
I thank you so much. I mean, success to me from this is to inspire other people who are here, who hear this and run with it, and then I host them as the experts in this field. That's really what success looks like, because you all, as the next generation, are going to push this forward. This is going to be your life, and as the digital natives that everybody here is, just push against tradition. and really try to think creatively about how these technologies can improve patient outcomes. And I think that's a great way and a great lens to view this through.
And that's really an amazing last words also from you, Doctor, because all throughout my experience of connecting with professionals, there's just really one thing that is common to those who respond. And from my own experience, really, it's really the gratitude of the person whom you are talking to. And it really goes to show that they have this intentionality to serve and probably to deliver education or to do something for others. And I really appreciate that last word that you mentioned a while ago. Thank you very much also to our participants. So we're about to close our event. And for those who are here since the beginning, just you may want to do our post-evaluation survey so that we can also provide Dr. Eric with the results of this survey and also probably information about the participants who attended for today's event. Thank you very much. And we will be giving you only 2 minutes and then we will be closing in our session. Thank you.
Thank you very much, and good evening from the Philippines. Thank you, Dr. Eric, Dr. Bench, Ma'am Nest TV. Thank you very much to all your students. May I go ahead? Bye-bye.
Thank you. Dr. Eric, I'll provide you with the result of the evaluation as well. And also you
Yeah,
will see-
please do. I'm always looking to get better. So please send me any and all feedback.
But doctor, on the other hand, there will be, I mean, little probably comment and feedback because most are not exposed to it because it's really something new. I mean, and probably haven't tried to use because even in conferences, when I go to conferences, like what just the conference here, the simulation conference that just happened around January, they have booths with the talks about this augmented reality, VR, and really the students got interested to it. This generation of students, I mean, they're interested on how it works, on how to use that. So it's really something that needs to be explored by higher education institutions and by colleges and programs, especially in health education.
Yeah. I mean, part of it is just giving them the language. The second is getting past the nice new shiny thing. And then the last thing is inspiration. You know, like that's the whole goal of this is they don't need to walk away knowing everything, but they need to be curious and they need to be inspired and they need to think about critically moving beyond just the shiny new thing and how actually it's going to be helpful for what they're doing. And hopefully some people will actually take it and run with it.
Yes, because doctor, as I told you, curiosity. It's really more on curiosity because even
Yeah.
we have students from nursing education here in the master's level, and it's not yet in their books even. Little information, not yet fully expanded. So meaning really an area that really needs a lot of researchers and a lot of educational or probably interventional research in terms of the on its impact on the outcomes in different courses probably or in different fields in nursing, clinical reasoning and stuff. All right.
Absolutely. I do think I'm hoping some people run with the game escape rooms because I think that's something you can do today, and I think it's really fun and interesting.
Yes, doctor. Yeah, it also something that I have been trying to see when I look at journals also. But really to try that one, we haven't. But as I told you, an area that needs a lot. But it's fun from what I've seen.
It's very fun, yeah.
In videos and also in the in journals. So
Yeah.
thank you so much for attending.
Thank you, Benjo.
Thank you very much, doctor. I will keep in touch for sure. So I will leave the room now. So I will be providing you the evaluation later. Thank you.
Beautiful. Thank you. Thank you, Benjo.